Hello and welcome. Today's session focuses on LO1, Understanding Perspectives of Quality in Health and Social Care. We'll explore what defines quality, the key stakeholders, and how change management shapes high-quality care. The unit aims to develop an understanding of change management theories in global organizations. It identifies and uses change models. Different perspectives affecting health and social care service quality are explored. Evaluation methods empower users of services. Understanding these factors is essential for effective healthcare delivery. Stakeholders in health and social care include commissioners, customers, and professionals. Stakeholder analysis involves mapping and managing these groups. The 4 and 9 sector tables are tools used in this process. Synergy and antagonist analysis are also crucial. Effective management ensures better service quality. Quality in health and social care is seen through safety, effectiveness, and person-centeredness. Timeliness, equity, and efficiency also play roles. Staff, patients, and stakeholders have unique views on quality. These perspectives help define healthcare standards. Understanding them is vital for delivering effective care. Care users seek continuous quality improvement and safety. They expect high efficiency and satisfaction. Modern technologies increase user expectations. Users demand pleasant experiences and involvement in decisions. This perspective changes with evolving user needs. Providers focus on patient-specific needs and safety. Efficacy and timeliness are crucial. Fairness ensures equal access to all. Providers aim for desired health outcomes. These views shape the quality of care provided. Improving care quality involves teamwork and defined responsibilities. It includes measuring processes and applying best practices. Safety systems and better communication are essential. Managers focus on patient and worker satisfaction. Their perspective is complex and multifaceted. Stakeholders like patients, professionals, and regulators play key roles. They ensure quality and standards in health settings. Collaboration among stakeholders is crucial. Their interconnected roles impact service quality. Each stakeholder brings unique contributions. External agencies set and maintain healthcare standards. Regulatory bodies like CQC inspect providers. Accreditation bodies promote quality assurance. Professional associations advocate for policy improvements. Their roles ensure high-quality care delivery. Poor quality care affects patients and providers. It leads to increased morbidity and costs. Trust in healthcare systems declines. Legal actions and ethical dilemmas arise. Addressing quality issues is vital for effective care. Quality evaluation involves audits and surveys. Performance indicators track service efficiency, peer reviews, and accreditation validates standards. Incident reporting identifies systemic issues. These methods ensure continuous improvement. Clinical audits review care against criteria. They identify gaps and improvement opportunities. Audits can be time-consuming. They are crucial for maintaining standards. This method enhances service quality. Surveys measure patient satisfaction. They provide direct user feedback. Limitations include subjectivity. Surveys may not reflect clinical care quality. They are valuable for understanding patient experiences. Indicators track metrics like readmission rates. They are objective and easy to monitor. Not all quality aspects are covered. Indicators provide a snapshot of service efficiency. They are vital for quality assessment. This comprehensive approach shapes high-quality care delivery. If you have questions, message us on WhatsApp at 074-8436-1688. See you at the next session. Thank you for your attention.